Teaching each other. Exceptional patients want to be educated and made doctors of their own cases. One of the most important roles they demand of their physicians is that of teacher. As I began my transformation, people began to tell me things I hadn't heard before. I learned what many doctors are like in their offices. They shout. They keep patients waiting for 2 hours but refuse them 5 minutes of discussion. One patient told of walking into a doctor's office and finding a sign on the desk that said, "Compromise means doing it my way." My advice is, if you see a sign like that, turn around and walk out. As I began trying to teach my patients in the first ECAP group, I was amazed by the results. People whose conditions had been stable or deteriorating for a long time suddenly began to get well before my eyes. At first, this made me very uncomfortable. I felt they were getting well for illegitimate reasons. Their progress had no obvious relation to drugs, radiation, or other traditional treatments. I felt like a charlatan or swindler and actually suggested disbanding the group. At that point, my patients had to explain to me what was going on. "We're getting better," they told me, "because you've given us hope and put us in control of our lives. You don't understand because you're a doctor. Sit and be patient." I did, and they became my teachers. Then and there, we adopted as our motto a sentence from the Simonton's book. "In the face of uncertainty, there is nothing wrong with hope." Some doctors have advised patients to stay away from me so as not to build up false hope. For most physicians, giving false hope simply means telling a patient that he or she doesn't have to behave like a statistic. Instead, I say each person could be the one who survives because all hope is real in a patient's mind. Refusal to hope is nothing more than a decision to die. I know there are many people alive today because I gave them hope and told them they didn't have to die. As I began to learn from exceptional patients, I was finally able to decide wholeheartedly to remain a surgeon, so as to have direct long-term relationships with patients. But I broadened my role from that of a mere mechanic to include some of the functions of a preacher, teacher, and healer. I accepted patients as individuals with choices and options. We became a team. A year before I began ECAP, I had shaved my head. Many associates thought it was a message of empathy for those who lose their hair during chemotherapy, but it had nothing to do with that. I later realized that it was a symbol of the uncovering that I was trying to make, bearing my own emotions, spirituality, and love. In fact, one nurse reminded me that shaving the head is standard preparation for any operation on the brain. The reactions were often revealing. Many people began to talk to me in a different way as though I were handicapped. They shared their pain readily. Some physicians berated me for being different, all the more reason for keeping my new look. My motives for bearing my head became clearer at a workshop with Elizabeth Kubler-Ross. One of her techniques is to have participants make drawings illustrating aspects of their lives. I made a picture of a mountain with snow on top, drawn with white crayon on white paper. Below it was a pond with a fish out of water. The key was that something was being covered up, white on white, and the spiritual symbol, the fish, was out of place. I realized that what I meant to uncover was my love and spirituality, not my scalp. It is from this period that I date my true career in healing, for it's only then that I found the full meaning of the work. The meaning consists of teaching patients how to live, teaching not from a pedestal, but rather with the knowledge that we teach what we want to learn. I became, as Bobby phrased it, a privileged listener. I began to hear all sorts of things that my patients felt were too emotional or too weird to tell other doctors. A few years ago, for example, a woman named Mary came to see me after her consultation with one of my surgical associates. She asked, "Are you the one who does visualizing and all that stuff?" When I told her I was, she said, "Good. I want to tell you something. Somebody's with me all the time. He wears a white robe and a purple sash, and he has bad teeth, and he's always in the room." I asked her, "Well, what's his name? What does he have to say?" She said, "I don't have the nerve to talk to him." Mary is afraid to tell her family or her own doctor about her companion for fear they'd think she was crazy. But once she thought I was a little weird, too, it was safe to tell me. Such openness is an enormous advantage for physicians. How can we hope to help people who can't tell us everything that's troubling them? What a relief to this woman to find out that her guest might be just a spontaneous version of my own guide, George. Soon after we founded ECAP, some members of the group began to tell me that other physicians thought the things I was doing were crazy. By then, however, I was too happy about the members' improvement to care. I told them, as long as you do well, I don't have to worry about my reputation. Often, I can suggest exactly what patients' emotional troubles are based on the symptoms and location of their disease. After emergency surgery to remove several feet of dead intestine, a Jungian therapist recently told me, "I'm glad you're my surgeon. I've been undergoing teaching analysis. I couldn't handle all the shit that was coming up or digest the crap in my life." Any connection with her feelings might not have occurred to another physician, but it was no coincidence to us that the intestines were the focal point of her illness. Recently, after a mastectomy, a woman said to me that she needed to get something off her chest. I was tremendously excited after my first experiences with ECAP. I tried presenting my experiences at medical meetings. Almost no one was willing to admit, well, maybe there's something there, I'll try it. As a result, even though there is now plenty of scientific data to argue for psychotherapy and treatment of cancer and other diseases, I became convinced that statistics rarely alter deeply held beliefs. Numbers can be manipulated to make bias seem like logic. Rather than dwell on statistics, I now concentrate on individual experiences. To change the mind, one must often speak to the heart and listen. Beliefs are a matter of faith, not logic. The Healing Partnership. One of the best ways to make something happen is to predict it. Pooh-poohed for some 20 years by the medical establishment, the placebo effect, the fact that about 1/4 to 1/3 of patients will show improvement if they merely believe they are taking an effective medicine, even if the pill they are taking has no active ingredient, has now been accepted as genuine by most of the profession. I am not urging that Western technological medicine be abandoned for earlier kinds, but I am asking that we become open to the healing gift within us. Science teaches that we must see in order to believe, but we must also believe in order to see. We must be receptive to possibilities that science has not yet grasped, or we will miss them. It's absurd not to use treatments that work just because we don't yet understand them. The placebo effect depends on a patient's trust in the physician. I've become convinced that this relationship is more important in the long run than any medicine or procedure. To create a relationship of trust, the doctor and patient must learn each other's beliefs. The belief systems of physicians and patients interact, but patients' bodies respond directly to their own beliefs, not their doctors'. Physicians tend to be more logical, statistical, and rigid, and less inclined to have hope than their patients. When physicians run out of remedies, they're likely to give up. They must realize, however, that lack of faith in the patient's ability to heal can severely limit that ability. We should never say, "There's nothing more I can do for you." There's always something more we can do, even if it's only to sit down, talk, and help the patient hope and pray. The usual attitude of doctors is summed up perfectly in the experience of Stephanie, one of our ECAP patients. After the diagnosis of cancer, her doctor outlined the rest of her life as predicted by statistics, right into an early grave. She asked what she could do, and he told her, "All you've got is a hope and a prayer." She asked, "How do I hope and pray?" He replied, "I don't know, it's not my line." Her ECAP experience taught her how to hope and pray, and Stephanie has altered the course of her disease, exceeding expectations, and her doctor is now making notes about her success. Later she wrote that this doctor, in mentioning hope and prayer, was actually prescribing the one medication that was going to cure me, and he never even knew it. The reverse effect can even kill. Frances, a woman in her 80s, came to me when she lost faith in her former physician because of his negative attitude. Despondent because of repeated nagging illnesses, she reached out to him for reassurance, and he asked her, "Well, how long do you want to live anyway?" She was smart enough to see what this outlook was doing to her, and she left. I remember one man who wasn't so lucky. Ellen, an ECAP group member, once called her husband Ray, who was hospitalized with cancer, to see how he felt. He said, "Fine." 15 minutes later, she arrived for a visit, and he was dead. In the interim, Ray, who'd been in and out of the hospital several times, had asked his doctor when he'd be able to leave. After the reply, "Oh, I don't think you'll make it this time," he died within minutes. The physician's habitual prognosis of how much time a patient has left is a terrible mistake. Physicians must stop letting statistics determine their beliefs. Statistics are important when one is choosing the best therapy for a certain illness, but once that choice is made, they no longer apply to the individual. All patients must be accorded the conviction that they can get well, no matter what the odds. Exceptional patients have the ability to throw statistics aside to say, I can be a survivor, even when the doctor isn't wise enough to do so. Just think of the courage it took for someone to conquer a certain type of cancer that no one had ever conquered before. Hope instilled that kind of courage in William Calderon, who achieved the first documented recovery from acquired immune deficiency syndrome, AIDS. Calderon was diagnosed in December 1982. His doctors told him he would probably be dead in 6 months. Understandably, he became depressed and hopeless. Almost immediately, Kaposi's sarcoma, the type of cancer that most often accompanies AIDS, appeared and began spreading rapidly on all areas of his skin and throughout his gastrointestinal tract. Soon Judith Skutch, co-founder with astronaut Edgar Mitchell of the Institute of Noetic Sciences and now president of the Foundation for Inner Peace, arrived at Calderon's hairstyling salon for her regular appointment. Noticing by his eyes that he had been weeping, she got him to tell her the reason. Her next words turned out to be the key to saving his life. She said, William, you don't have to die. You can get well. Skutch described the Simonsons' work with cancer patients. With unwavering love and support from her and from his lover, Calderon came to believe in his own survival. By continuing at the job he loved, he refused to give in to the disease. Instead, he began meditating and using mental imagery to combat it. He worked to restore strained relationships with his family and achieved peace of mind by forgiving people he felt had hurt him. He loved his body with exercise, good nutrition, and vitamin supplements. And from that point on, his immune system showed increased response and his tumors began to shrink. 2 years after the diagnosis, Calderon showed no signs of AIDS. It takes enormous strength to make the kind of spiritual and psychological changes that people who experience self-induced healings always make when the voice of authority is telling you you're supposed to die. I often get letters from doctors about patients I've referred. When a doctor reports amazing improvements in a patient's condition, he or she almost never mentions that person's beliefs and lifestyle. But when I inquire, I find the patient always has made some drastic change toward a more loving and accepting outlook. The patient seldom tells an unreceptive doctor about this, however. As long as my patients are living in a way that has value to them, I'm there to help them continue. However, if a patient has decided it's time to die, I see no contradiction in aiding with that too. I can help resolve conflicts that drain energy, knowing that this resolution may initiate healing after all.